Hello again, everyone. My name is Marty Guthmiller, and I am CEO at Orange City Area Health System, bringing you today on November 16, 2020, the 73rd edition of our COVID-19 community briefings. As it is a Monday, I do have a local scoreboard. I have a lot of local information today that I'll go over after I go through the stats, but just a lot of stuff. Obviously, we're in full-blown community spread, and there is lots of numbers to go through. They are sobering numbers, to be honest, and that there's a lot of them. And so we're going to start with the local scoreboard, meaning that these are the tests only performed at Orange City Area Health System. As of today, this morning, we had 1,302, excuse me, 1,302 positives of 6,589. That is a 19.76% positive rate. For the week, it makes 19% look very pale. For the week, we had 227 positives of 567 tests. That's a 40% positivity rating. Last week, we were at 56.7. The week before that, 34. So very high numbers on a local basis in terms of positivity. In the aggregate, however, we are at 19.76. Sioux County, 3,239 positives of the 10,978 tested. That is a 29.5% positivity rate. We have had 168 new positives since last week, Thursday. The 29.5% positivity rate is compared to 28.8 prior to last Thursday and 28% a week ago. Yesterday, as an example, we had a positivity rate in Sioux County of 35.2%. So can expect probably that number of 29.5 to be over 30 the next time based on what we're seeing right now. Speaking of 30, Sioux County is now number 9 on the 14-day average positivity rate at 30%, 30.0, number 9. Previously, we were 29.7, 28, and 27.2. So the stair climb continues. Lyon County, number 5 in the state at 36.3%. They were 31.7 last Thursday, 23.8 before that, and 21.1. So they've had a significant increase in Lyon County. Plymouth County, number 7 at 31.1. They were previously 28.9, 29.8, and 26.3. O'Brien County, way down, number 32. But before we celebrate too much, their percent really hasn't changed. They're at 25.3%. Previously, they're at 26, 25.9, and 26.8. So they've dropped down, but what that tells you is how many others have gone up. Speaking of going up, number 1 county in the state of Iowa, 14-day average, Jones County, 50.8%, 50.8. Number 2 in the state, Page County, 46.3. Number 3, Calhoun County at 41.3. So significant numbers there for sure. 98 of the 99 counties in the state of Iowa have a positivity rate of 11.8% or higher. Moving on to Region 3, again, some sobering information there. Number of hospitalizations, 218. The first time that we reported a number over 200. Previously, last Thursday, we were at 183. A week ago, we were at 167. The time before that, 148. And the time before that, 139. So there's just no question that while our positivity is going up, the number of hospitalizations is going up as well. Again, I'm not sure that any more people are requiring hospitalization as a percentage of positives. It's just that there are so many positives that even a small percentage of people requiring hospitalization results in a big number. And we'll talk more about flattening the curve a little bit later. Again, back to Region 3. The number of ICU patients in Region 3, the 20 counties in Northwest Iowa, is 38. Again, as a function of the number of hospitalizations, probably not a lot different. It's just that the hospitalizations are so much higher. The 38 compares to 32 previously, 26 before that, 25, and 20. We've had 43 people admitted in the last 24 hours. That is the biggest number that I saw. Last time we talked, we were at 32 in a 24-hour period as the biggest number. Now it's 43. These are records we don't want to keep breaking. In Region 3, we have 18 people on ventilators. I should also mention the lion's share of hospitalizations in Region 3, in our area, is in Woodbury County. I got the census this morning from Sioux City, and that is 98. They currently have 98 COVID patients hospitalized in Sioux City. That includes Woodbury County residents and others, of course. And of those 98 COVID inpatients, 13 are on ventilators. So 13 of the 18 in Region 3 are in Sioux City on a ventilator. Iowa, 187,035 positives of the 1,105,000 tested. That's a positivity rate of 16.9%. Again, we've talked about the level of positivity that it requires to influence percentage move on 1,000,001 tests, 1.1 million tests. It's a high number. And we've moved from 16.9 from 15.9, 15.1 prior to that, and 14.1. So we've gained in a negative sense here, a higher percentage on a very big denominator. And so that means that the number of positives is of course much higher than 17% in the aggregate. Hospitalizations across the state, again, setting new records. 1,279 includes 76 people who are hospitalized out of state, 76 Iowans who are hospitalized out of state. Sioux County, and generally, excluding Woodbury, generally speaking, Northwest Iowa, minimal impact. Sioux County, as an example, we're at 13. Previously, we were at 15. And again, the timing is a little different because when these reports are timed and what's actual. I'll go into actual in just a minute. Plymouth County, 12. They were previously at 8. O'Brien County, 8. They were previously at 6. Lyon County, 2. Previously at 1. Woodbury County, 51. Woodbury County residents are hospitalized. That number was 41 previously. Polk County, 114. Previously, that number was 105. The time before that, 85. I do know that Polk County hospitals are being stretched right now, as we all are, but I think stretched seriously. Access to some equipment and things like that. So be concerned for those folks. This is very real, and Polk County is getting hit pretty hard right now. We have had 64 additional deaths since last Thursday. That number now officially in the state is 1,991. Sioux County has 22 deaths officially, and they have come out with a new demographic today that just breaks it down a little bit further. I think before we always talked about the 61 and over. That's at 89, 90%. The new aggregate is 91%, so it really hasn't changed that much. But here's the new breakdown, and these are the numbers I'll be giving you in the future. 60 to 69 age group is 16%, 1/6. 70 to 79 is 23%, and 80 plus is 52%. And so when you add the 16 and the 23 and the 52, you should get 91. And so that's where we are in deaths in the state of Iowa. Now we're going to move on to some local information, and this is kind of in the order that I received it today. And so it's not, I hope it flows okay, but I want to give you some local things going on at Orange City Area Health System today. First of all, we are in the process of receiving some new, what they referred to as monoclonal antibody. It'd be similar in another therapeutic to remdesivir. Just to give you an idea of the scarcity of this, we are getting 14 doses. And there's very specific utilization of this monoclonal antibody. For example, it cannot be on an inpatient. It cannot be on anybody on oxygen. It is an IV infusion that requires about an hour of infusion and about an hour of observation. There are very specific requirements as to the characteristics of a patient to receive this antibody, but it is new. It's the latest stuff. It's just our allocation of it is pretty limited. How long that's going to go, we don't know, but we are expecting 14 doses soon. And we're not sure exactly how they're going to be replenished. So if there's another 14 coming at some point, but just wanted to let you know that we are up on that, and we are offering many of the latest treatments, therapeutics that are out there. At our nursing home, Prairie Ridge, nothing particularly new. No news is good news in this case. All staff and residents tested negative last week. And so that's a very blessing. We're very grateful for the dedication that it takes for our staff to do that. That is no small feat. And so we're very, very pleased that that is the case at our nursing home. Landsmere Ridge Retirement Community, again, no news. Good news, all quiet on the northern front, as we say. And so no news is good news there. This morning at the hospital, things are continuing as normal as we can. We had 18 inpatients this morning. 13 of those 18 were COVID positive patients. Some of those patients have been with us quite a while. And because of that, they're outside of what would be considered the infectious time of the COVID virus. And so they are fine just outside of our negative pressure area because they've been here for so long and they are past the point. But one of the things that we also are doing that could negatively impact some family situations in Orange City is we are evaluating the acceptance of skilled patients being transferred from a larger facility to ours to rehab here in Orange City. Generally speaking, we're not accepting those skilled patients because we don't believe we can risk giving up a bed that we need to keep available in the event of a COVID patient needing that. So we are limiting our skilled patient, and that might affect somebody, and we apologize in advance for that, but we're doing that to make sure that we have the capability to address the more emergent needs that we have. Elective surgeries are continuing. We are not using up resources that aren't employed other places. Our staffing is okay. Our testing is okay. So we are not really modifying to any significant degree our elective procedures at this point. We do occasionally evaluate inpatient surgeries that are elective cases that would require inpatient stays, total knees, for example. But so far, we've been able to accommodate all of those surgeries. Just last week, as an example, I had a report this morning from Donna Moorhead, our head of laboratory, Donna reported that in the month of November, we've done 287 tests in our lab. Now, that doesn't include Test Iowa and things like that. I'll give those in a second. 287 tests performed in the month of November in our lab had a 47% positivity rate. So half of those tests that we performed locally were positive. In addition to that, we did about 250 Test Iowa tests last week. And so it gives you a little bit of an idea in the volume, north of 500 over the last week to 10 days, and a very high positivity rate. On occasion, we've asked about you guys helping us out relative to protecting our employees. We continue to ask for that. To date, we've had 104 employees test positive within the health system. In addition to that 104, we've had some employees who have tested positive for the antibody, what we call the IgG test. So when you look at it, we've had about 20% of our workforce at some point be displaced. And so that has consequences, obviously, and that's what we're trying to guard against. Our walk-in clinic, as another example of volume, set a record on Saturday, seeing 27 patients. Just this past Saturday. Sunday wasn't quite as busy, but it was just under 20, my understanding. A lot of talk about the vaccine coming out. We're ready for that. We've signed up. We're in the distribution channels, provided that they are fulfilled. We will be offering that vaccine as soon as it's made available. Our current understanding is that healthcare workers will be offered the vaccine first. Senior care members, community members will be offered it next. And after those two, my general understanding is that it will be offered to the public. Much more information will be coming on that as we get it ourselves. But we're understanding that it might be a few weeks away, which would be really good news. So if that's the case, stay tuned. There'll be lots of information on that coming out. Just a couple things, and this is in the form of an ask. We need your help. One of the things that we need in order to keep our visitor policy the way it is, we need people to be honest with us. If you're not feeling well, if you're ill, if you have tested positive, you need to answer those questions positively. You need to answer them honestly. We've had some situations where that has not been the case, and that puts everyone at risk. But what it mostly puts at risk is the fact that if that continues, we're going to have to take away all visitors because we simply can't risk bringing the virus into an environment where we shouldn't have it. And so the screening is done for a reason. The screening relies on integrity and honesty. And we're asking that all of you who fill that out, answer those questions, do so honestly. And in doing so, you'll preserve the right for other patients to continue to receive visitors. And again, our only other recourse is to pull the visitor right from everybody. And we certainly don't want to do that because that has its own ramifications as well. The other thing that we'd like to ask your help with is continuing to flatten the curve, continuing to do all those things that we've asked you to do all along. Wear your mask, be honest, avoid large groups, wash your hands, keep your engine tuned, all those kinds of things. And mentally, again, to control what you can control. But really, we need your help, avoiding the large groups, wearing your mask, social distancing, hand hygiene. We need to keep that curve low. Again, it's not that more people are becoming acutely ill. It is that more people are positive, which that same percentage applies to a larger number, means that we could overwhelm the health system collectively. And it is happening in areas, probably more like urban areas at this point. But we need to keep that number down. Again, the vast majority of people are coming through it just fine. But that doesn't mean that some people don't get sick, and it doesn't mean that there are downstream consequences that we need to guard against. We are in the thick of it, community spread, for sure. The vaccine gives us some hope, and we hope that that comes very soon, but we still need to get through the next couple of weeks. The good news is PPE supplies are good. Our testing supplies are good. Our staff is hanging in there. But it's not something that we take for granted. So I'm going to stop at this point. My only other comment for today is, Lord willing, this is our last briefing for the week. I do anticipate being gone for a couple days, but look for a briefing next week, maybe Monday, maybe Tuesday, but there will not be a briefing towards the end of this week. With that, I'll sign off with my normal sign off, meaning stay strong, stay vigilant, and above all else, stay healthy. Thank you for joining us, and we look forward to seeing you again next week. Thank you.